everyone. Welcome to the call. I'm Tori Kim, and I'll be presenting today about the healthcare reform legislation and its effect on Medicare. A little bit about me. I've been working in the coding field for 12 years. I've been editor of Part B Insider for just about 3 years. When I'm not writing Part B Insider, I'm spending time with my 3 wonderful and rowdy sons, or with my husband here in North Carolina, where I've lived for 4 years. On slide 3, you can see here the Patient Protection and Affordable Care Act, which is what we'll be discussing today, was signed by President Obama on March 23rd. As you can see from the photo on the left, many legislators were cheering with excitement on the day the law was passed, whereas some people in medical billing offices sort of maybe felt like the woman on the right when they thought about what the new law might do to their coding processes. And that's what we're here for today, to give you a small sampling of how the bill will impact your Medicare systems. On slide 4, we're taking a quick look at our agenda. We'll be discussing the following issues during our session today. What is the PPCA? How will it affect Medicare? What are the implementation timelines? Who's responsible for making changes to your systems? What steps should you take now? And then we'll offer several healthcare reform resources that can give you a little more information if you're interested in studying this issue a little more deeply. Slide 5, we've all heard a lot about the law. Let's take a look at exactly what it involves. The Patient Protection and Affordable Care Act, also known as the PPCA, HR 3590, or simply the Healthcare Reform Law, includes over 2,000 pages of healthcare-related provisions that will take effect over the next several years, some even kicking in this year or have already. Many of the law's other provisions, such as pre-existing condition coverage and insurance coverage for adult children of insured parents, have received widespread media coverage, but some practices are still unclear of how it specifically impacts Medicare. So today's presentation will break down a few of the most important factors involving Medicare pay that the PPCA has in store. On slide 6, this particular issue has gotten some press. People are confused about it, so we'll go over specifically how the law will affect Medicare. And please note that on each slide involving the law, we've included the section number alongside the title. This one will say Section 4103. That way, if you access the link at the end of this slideshow and you want to get a better look at the entire law, you won't have to wade through all 2,300 pages. You can skip right to the applicable section. So that might be helpful. So here we're talking about one of the most interesting additions to the healthcare legislation is that it includes a provision that offers annual health risk assessments to Medicare patients. The visits are annual unless the patient has their Welcome to Medicare exam that year. In those cases, the health risk assessment will begin the subsequent year. The healthcare reform indicates that the annual wellness exam, which will go into effect next January 2011, this exam is free to the patient. No co-insurance or deductibles will apply. The assessment includes an exam of height, weight, body mass index, blood pressure, and other routine measurements. The other routine measurements statement is actually from the legislation. That's not me trying to summarize it. So at this point, it hasn't been spelled out specifically what those are. Based on the outcome of that assessment, the practitioner will create a screening schedule that will cover the next 5 to 10 years. The doctor will also be able to offer the patient a list of risk factors and conditions for which additional interventions are recommended. Plus, they can offer referrals or advice to other professionals to provide interventions on issues such as weight loss, physical activity, quitting smoking, nutrition, and fall prevention. Moving on to slide 7, you'll see that primary care practitioners will get a 10% bonus starting January 1st of next year, 2011. Practitioners who qualify will be doctors, nurse practitioners, clinical nurse specialists, or physician assistants with the primary specialty designation of family medicine, internal medicine, geriatric medicine, or pediatrics. Those specialty designations will have to be noted in Medicare's system. So if you're registered with Medicare as another specialty, say dermatology, but you've converted your practice to a family practice, you will have to change your designation with Medicare to qualify for this bonus. So to qualify for the 10% bonus, the law stipulates that the primary care practitioners will have to bill at least 60% of their allowed charges as primary care services. And those are defined by E&M codes 99201 to 215. Then there are the nursing facility or rest home care codes 99304 to 99340. and home services codes 99341 to 99350. Because many primary care practitioners, and especially those who practice in rural areas, may be performing other procedures in addition to their E&M services, that 60% threshold could be an issue for some providers. And some of the primary care specialty associations have been keeping an eye on this issue. So that's something to be aware of. If you're in a primary care specialty, check in with your association and just see if there's any more details that come out about this specific provision as it gets closer. Moving on to slide 8, you'll see that you now have 1 year to submit claims. Now, in the past, Part B providers had over a year to submit their claims to Medicare. In some cases, they had over 2 years. But the new legislation will require you to submit your claims 1 calendar year after the date of service. This is applicable retroactive to January 1st of this year. So this law is in effect right now. Claims with dates of service before October 1st, 2009, this past October, must follow the timely filing rules that they were subject to at that time. Claims with dates of service from October 1st, 2009 through December 31st, 2009 have to be submitted by the end of 2010. They have till December 31st of this year to turn in their claims. Medicare does have a very good electronic filing system, so most practices don't have big problems with old claims sitting around waiting to be filed. But in some cases, this 1 year threshold might be an adjustment for you. Also, keep in mind that the legislation indicates that some exceptions to the 1 calendar year period may apply, but it's not yet clear what types of situations will qualify for exceptions. So that's another issue that will be fleshed out most likely as we go along with this process. But for now, they have not specified that.